Hey everybody, Dr. Hagmeyer here, and last week I got off the phone with a lady who lives down in Mississippi, and the reason she reached out to my office is because she is at her wit's end, okay? She's been struggling with diarrhea, and no matter what she does or who she sees, there's no improvement. She's been tested for celiac disease and Crohn's disease and ulcerative colitis. All these tests were negative. She's been to several different specialists, and she's seen no improvement. All her colonoscopies and endoscopies are completely normal, and her doctors have basically no direction or suggestions to even point her in. And so in today's video, I want to unpack some of the areas that need to be explored beyond the reasons of IBS and diarrhea, some of the lab testing markers that are important to evaluate in situations like this. And also perhaps you're a person who can relate. Perhaps you're watching today's video and you yourself are struggling with diarrhea and the frustrations of not having any answers. Perhaps you too are afraid of leaving your house because you can't go anywhere. You're afraid to go on a vacation because you're afraid of being caught out in public and unfortunately having an accident in your pants. And that can be obviously extremely, incredibly embarrassing. So I want to talk to you about some of the additional problems that many doctors and GI specialists simply don't bother looking into. These could be some very real reasons why you're not getting any answers. And if we can point you in a direction to get that help that you need, that's why this video is being done. Now, what I find in many patients who have frequent diarrhea, they get a colonoscopy. In many cases, the colonoscopy doesn't show your typical lesions as seen in Crohn's disease or ulcerative colitis. And so you walk out of that doctor's office being told to eat more fiber and relax, okay? Try not to get too worked up over things and just stick to a regimen of medications that ultimately, will stop the diarrhea, but unfortunately don't really get to the underlying root cause. And so the advice of eating more fiber is not always the best advice, especially if you have what's called small intestinal bacterial overgrowth. And the other thing here is, how are you supposed to relax when your whole life has been disrupted because of this diarrhea? And so that's just unrealistic. One of the things I like to do with patients is run what's called a functional stool test. And this is a stool test unlike any conventional testing your doctor's office offers. And here's why. Several tests we offer through our practice allow us to use what's called PCR testing technology. I'm going to explain a little bit about what that is, and of course, one of the most important tests that we run in our practice as it relates to GI problems. And so the thing that's great about this PCR testing technology is that it allows us to gain invaluable insight into the gut microbiome and into the gut flora. And what it does, it allows us at this point in time to see 24 different what are called commensal bacterial targets. And this is incredibly exciting because it allows us to look at the kinds of bacteria, the number of good bacteria, so-called the army of your digestive system and your immune system. And it also allows us to look at the overall, what we refer to as biological diversity. And I like to think of the terrain of the gut like a rainforest. If you can imagine a rainforest, a healthy rainforest has a very, very high biological diversity. There is an ecosystem in your intestines, and if this ecosystem becomes strained or stressed or imbalanced, let's say because either an overgrowth of yeast or certain kinds of bacteria that are picked up, or bacteria or funguses, or medications or steroids or so forth, that ecosystem loses its homeostasis and loses its balance. And ultimately, this loss of balance has a domino effect and shows up in a number of ways. Okay, the symptoms in one person might be diarrhea, in another person it might be constipation, another person it might be bloating. And so while the symptoms of these gastrointestinal disturbances is not as important as finding what the functional disruption is, that's what makes this test so great. The other thing about this test is that it allows us to look at various biomarkers indicating how well you're breaking down food, how well you are breaking down fats, how well you're breaking down proteins. So in other words, it'll look at things like pancreatic elastase. It looks at the percentages of what's called short-chain fatty acids. It looks at protein products. It looks at something known as putrefactive short-chain fatty acids and things like embutyrate. So it gives us just a a great understanding of really what's happening in the digestive system. So not only is a person suffering with diarrhea or constipation, but what's the reason behind it? How can we improve their digestive function? Okay, and so that's why this test is great. This is especially important when it comes to people struggling with diarrhea. Okay, just for a minute, think about what's happening with diarrhea. Okay, you have food that's not being properly digested. It's moving through the intestines too quickly. This leads to malabsorption of nutrients that are really intended for cellular healing. And if we're going to focus on repairing your body and regenerating the body, how important is it and how vital is it for us to understand where the breakdown in this digestion process is occurring? Okay, that's incredible. The last piece of these tests look at the potential issues with intestinal inflammation and immunology. So here there are markers that make up part of this test. Things like calprotectin, lactoferrin, eosinophil protein X, and something known as secretory IgA. Now, these markers can track a patient's progress to the level of inflammation and the level of irritation in the intestines. And so this is a great test if you know that you have, that you're going in for a colonoscopy, for example, and you know there's inflammation there, and you want to track the progress of how, let's say, a particular protocol that you might be on, what kind of effect is it having on your body? The other thing is these kinds of tests offer so much more than the kind of testing ran by conventionally trained doctors and GI doctors. Okay, rather than just looking for a bacteria or an infection, we're getting a glimpse into the actual mechanics of GI function. So that's really incredible. This is what we call, again, a functional stool test because it evaluates various functions and how well your body is really executing those functions. So let's dive into some of the reasons behind why a person has IBS diarrhea. Number one, the number one cause of chronic diarrhea is referred to, or is caused by, I should say, intestinal dysbiosis. Now, I've done several videos specific to this topic of intestinal dysbiosis, and I would encourage you to obviously learn more about the many causes behind dysbiosis. But for many people who already have IBS, the treatments and the medications that you've received up to this point in time in your life are often the very cause of the condition you're trying to get help from, and which is ironic if you ask me, okay? Here's the thing. Research shows time and time again that people that have IBS or have been diagnosed with IBS have decreased populations of this good colonic bacteria. So in other words, the good guys have been beaten down and the bad guys have basically, have been given the upper hand. Now, it's the good bacteria throughout your gastrointestinal tract that serve numerous roles. Okay, many of these good bacteria prevent bad bacteria from colonizing or taking over the gut. Some maintain the pH of the intestines and the gut by producing lactic acid. Okay, you've probably heard of lactobacillus. Lactobacillus creates lactic acid. Some of these good bacteria produce immune system cells like secretory IgA. Others are vital to producing enzymes that help make B vitamins. And we all know how crucial that is to the immune system, but also to the mental health of a person. Okay? One of the things we know for certain about the gut microbiome is that when the balance shifts, okay, when the balance shifts towards dysbiosis, a wide variety of common illnesses, including not only IBS and IBS diarrhea can occur, but things like autoimmune disorders, diabetes, cardiovascular problems, kidney diseases, skin conditions, depression, bipolar. The list literally goes on and on. You can literally go on to Google and search any of these conditions on PubMed simply by typing in the condition, the word microbiome, and the word PubMed. Continuing and diving further into the causes of diarrhea include something known as bile acid malabsorption. And this might be something that is new to you. Not a whole lot of people talking about this, but I see this as a very big problem for a lot of people. Bile acids or bile salts are your body's natural laxatives. Okay, they are made in your liver, and then they're secreted by the gallbladder into the small intestines after meals. And it's these bile salts that are responsible for the digestion and the absorption of fats in the small intestines. So if you have a lot of fat not being digested and absorbed, it's going to end up in your stool. The second point to remember about these bile salts is that 95% of bile salts are reabsorbed in the last portion of your small intestines. And this is why this is important, because if they fail to get reabsorbed, and pay attention here, if they fail to get reabsorbed, then what's going to happen is they're going to enter into the large intestines. okay? Once they enter into the large intestines, they're going to stimulate water secretion, and they're going to increase the intestinal motility. And this is what causes the symptoms of chronic diarrhea. Now, one thing I forgot to mention earlier is that you're probably taking medications that bind up your bile acids. Okay, these are drugs called bile acid sequestrants. Okay, and the problem with these is that very often by taking these are going to lead to problems with the absorption of your fat-soluble vitamins. These are going to be things like vitamin A, vitamin D, vitamin E, and vitamin K. Things that are so important to actually rebuilding the mucosal lining of your intestines. So your diarrhea may be coming from a problem with the liver, it may be a problem with the gallbladder, or a problem with the reabsorption of the bile salts in the small intestines, okay? And guess what? The distal portion of the small intestines is like the last frontier when it comes to imaging, okay? It's not an area that can easily be accessible or tested. And so another common cause of diarrhea is something known as small intestinal bacterial overgrowth. And I won't talk too much about SIBO, or small intestinal bacterial overgrowth, because I've done tons of videos on this topic and even dedicated a whole video series that really covers everything from what it is to how to test it and why antibiotics are not always the best treatment advice for this condition. But just to give you a quick primer, real quickly, small intestinal bacterial overgrowth is a condition where you have excessive amounts of bacteria in the large intestines migrating up into the small intestines through a valve called the ileocecal valve. And once they get up past that ileocecal valve, they take up shop and they take up residence there in that lower portion of your small intestines where they don't belong. And they can create all kinds of problems with bloating and gas and constipation. So some people with SIBO will have constipation, some people will have diarrhea, but almost the common denominator amongst anybody with SIBO is the bloating. And notice that when you eat certain starchy carbohydrates or you take probiotics that you feel bloated, this could be a symptom of SIBO. So again, depending on the type and the amount of microbes present in the small intestines, this can have an impact on that. Okay. Now, remember what we said earlier, 95% of your bile salts are reabsorbed in the small intestines, and that if we don't reabsorb those salts, they get dumped into the large intestines where they can cause diarrhea. So if you now have an infection in the small intestines, aka SIBO, not only will you not reabsorb those bile salts, but you're also going to create all sorts of those vitamin deficiencies like A, D, E, K, B12, lots of other different B vitamins that are part of that. Now, the last consideration when it comes to diarrhea is a commonly overlooked area, which is autoimmunity. And this is one that I really want to spend some time on with you. This is a new area of testing, and this is very much in part thanks to Dr. Pimentel, who's done a lot of research. So you might be thinking, after I've said all this, you might be thinking, all right, Dr. Hagmeyer, my doctor tested me for Crohn's, he tested me for celiac, he's even tested me for ulcerative colitis, and those have all been ruled out. Are you saying that the cause of my diarrhea is from an autoimmune disease? And the answer is possibly yes. Okay, new research, again, by Dr. Pimentel, shows that some patients who have IBS have an autoimmune variant that was initiated after an infection or what we call an autoimmunity-induced post-infectious IBS. Okay, again, this is thanks to the works of Dr. Mark Pimentel from Cedars-Sinai Medical Center. And what he found out through his research, he found out that about 10 to 20% of the population of IBS sufferers, and this number obviously could continue to grow, have an attack of gastroenteritis or food poisoning. They travel to another country, they get exposed to water that's been contaminated, whatever. And what happens after that is they have this persistent diarrhea and this abdominal pain, okay? The abdominal pain kind of wears off perhaps in some cases. The infection is gone, the body has fought off the infection, but the symptoms of the diarrhea persist for months or even years later. Research suggests that this post-infectious diarrhea is associated by a mild inflammatory response in the bowel, and that has a systemic effect on the body, leading to symptoms of things like anxiety and depression. And this is something that I see quite often with my patients who have diarrhea, have tested negative for celiac, negative for Crohn's, negative for diverticulitis and ulcerative colitis, but yet they have markers indicating that there is intestinal inflammation. So they may, on that stool test, they may have elevated levels of lactoferrin, they may have elevated levels of eosinophil protein X, they may have elevated levels of calprotectin, okay? So this test that specifically looks at the possible contributing cause to diarrhea, this is a blood test, and what it does is it identifies something called anti-CDTB, which stands, that's one part of the test, and the other test that is measured is something called anti-Vinculum antibodies. And here's what happens. You get a bout of food poisoning, okay, or you get exposed to a toxin that's produced by E. coli or Salmonella or Shigella or Campylobacter, and what happens is you produce this toxin called CDT-B, okay? It stands for cytolethal distending toxin B. You break out with all the typical symptoms of watery diarrhea, maybe you're throwing up, you have a fever. Then what happens is these antibodies attack the CDTB toxin, but it also attacks a protein within the lining of the intestinal tract called vinculum. Okay, now vinculum helps these cells connect and communicate electrical signals to contract smooth muscle, allowing peristalsis. You may remember in a video that we did a while back, we talked all about this migrating motor complex. Well, again, this migrating motor complex is what's under attack. So if vinculum is damaged or destroyed, the electrical signal telling that muscle in your gut to contract and propel food and waste and bacteria are all disrupted, and this leads to, again, depending on the kinds of bacteria, in some individuals it may be diarrhea, in some individuals it may be constipation. So in closing today's video, I know we unpacked a lot of information. There are a couple things I want you to remember about chronic diarrhea. Number one is dysbiosis, bile acid malabsorption, SIBO, and autoimmunity can all be caused by past infections, the antibiotics that we take. And these are all things that really need to be considered when someone with diarrhea feels like they've hit a plateau or is not seeing improvement in their health. Number two, it's important to understand the root cause of your diarrhea. And the root cause in one person may not necessarily be the root cause in another person with identical symptoms. So this is why I don't suggest that you embark on this journey alone or just follow some cookie cutter recipe for diarrhea that you might be desperate in hopes for on the internet. Number three, we talked about the various tests needed to help uncover some of these root causes. We talked about the gut microbiome. We talked about pancreatic elastase. We talked about inflammatory markers. We talked about small intestinal bacterial overgrowth. And we also talked about that CTDB toxin as well as anti-vinculum antibodies. Number four, for many people with diarrhea, we get so hung up on diet that all of these things we just talked about go undetected. And if you've changed your diet and you're still not noticing a vast improvement in your health, it's time to dig a little bit deeper into what some of these other potential mechanisms might be. With that being said, I don't want you to give up on the diet, okay? I don't want you to go back to eating all those foods that are obviously very damaging that you've have learned about in past videos of mine. So don't give up on that. But understand that there's a lot more going on here besides just diet. And what I find is that for so many people with diarrhea and IBS is that everything becomes so stuck on diet, okay? And sometimes there are other metabolic causes other than just food sensitivities that a person might have. So again, work with someone who can help you navigate through this very complex condition, all right? So that wraps up today's video. I hope you enjoyed it. I want to encourage you to visit my website. There's just a tremendous resource. There's over 1,000 pages of articles and videos, various different supplements that we use in our patients, and just a lot of information on how I work with patients around the state and out of the country. So hope you found today's video helpful. If you did, subscribe to our channel, and also make sure that you basically just work with someone who's going to get into the deeper causes of why you're struggling, okay? Because it's just a matter of time before you lock down the cause of why you're not getting better, okay? Till next time, take care.